Ci sono altre domande?
I'm Italian, but I'll try to explain what I want to say, even if it's very, very difficult to explain this situation.
Where
Yes.
are you? Hello. Can you
Okay.
can you rise?
I know a baby. He's a child. His name is Max. He is 11, and his family is a bit. There is a high frequency in family of psychosis, depression, maniacal behavior. I talk about mother, father, two aunts, due zie. Okay, and grandfather and grandmother. There is a high frequency also of anxiety in some of these members of family. So I think that it's not it's can you give me can you explain me this
Are you actually
high frequency of illness, psychiatric illness could have determinated the autism in this son?
I think that's very difficult to
I
say.
think that answering that question completely would be qualify for the Nobel Prize.
Yeah.
So it's very difficult. But what we see clinically is that some problems adds up in some families. We know it's both genetic and environmental factors, and of course, there's not possible in psychiatry to isolate one factor developing a psychiatric problem. And anxiety is distributed also in the normal population in clusters. So I think it's almost, if you don't want to correct me there, it's very, very hard. But we see it, that it adds up and clusters in some families. And that might be also that people with autism have relatives with also with cognitive understanding problems, so that anxiety will spread in the family.
So I think what we're talking about is looking at it from a biopsychosocial perspective, where genetics, psychological factors, as well as social and environmental factors need to be taken into account. And that's with typically developing individuals as well. What we did find in the study with the 50 individuals in the sample was that with the people that did have a mood disorder, they tended to have a positive family history of depression, either in the siblings or the parents or the grandparents, but that was also the case with people with anxiety, so it was difficult to differentiate between the two. But certainly also stressful life events were increased in those that had a comorbid psychiatric disorder.
We often call that neurological sensitivity in families. That's what we tell these persons often, so that they know that it's not all separate things, but together it's there in the family.
That's a good expression, neurological sensitivity.
Yeah.
I don't know whether you are satisfied with our answers, but this is what we know.
Yes, enough.